to the Marathon Medic podcast. My name's Amy and I'm a junior doctor and running coach with an interest in sports medicine. This podcast series focuses on sports nutrition, and today I'm joined by Dr Stephen Mears, a senior lecturer in sports and exercise nutrition at Loughborough University. Stephen's research interests include fluid balance during and following exercise, and so we're chatting about the importance of hydration in sport. So hi Stephen, many thanks for joining me this morning on the podcast.
That's all right. Nice to have you. Nice to have me on. Thank you for the invite.
That's okay. So we're going to talk about hydration today, but you're a runner yourself, so I think it might be best to start with just learning a little bit more about your running background and what kind of running you do at the moment.
Okay. I'll say at the moment, not a lot. Slightly injured, but my background is definitely in running. I've been running since I was 10, 11. And keep going. I'm still doing some competitions at middle distance. So my primary goal is 800s and 1500s at the moment, maybe moving a little bit higher. But I've always had interest in running as a sport and immersing it completely, following all the races, following the marathon. I train here at Loughborough with the squad that we had, formerly under George Gandy until he sadly passed away last year. And so I compete for Charnwood in Loughborough and also Harrow in British League. And then I suppose my running background has kind of led me to some of my research as well, but I suppose we'll get onto that. But we do a lot of work with some of the marathons as well.
Yeah, so would you mind sharing about your professional background and then how your research interplays with running?
Okay, so I'm a senior lecturer at Loughborough University. My title is an area of sport and exercise nutrition, and it all started probably from my interest in sport and the fact that I wanted to do something I was interested in. And so I did my undergraduate degree in sport and exercise science at the University of Bath. I did an industrial placement there where I worked with the British Olympic team, and then progressed on to a PhD at Loughborough under Professor Ron Moore and Dr Susan Sheriff, looking at hydration and exercise, looking at the behavioural aspect of fluid intake and what drives fluid intake during different types of exercise. And then I did some research position at Loughborough for a year where we looked at the medical conditions in marathons, so looking at exertional heat stroke, looking at exercise-induced, exercise-associated hyponatremia, and looking at factors along those lines and how we could do some research on those. And that led me to my lectureship position at Loughborough, where I'm now doing work in hydration and performance, hydration and kidney health, and looking at also carbohydrate metabolism as well for endurance runners.
Does your research affect how you train and how you run, or is because it's kind of mainly focused on marathon distance, you don't feel the pressure when you're doing your middle distance races? Because I think some of the information that you must find must be a little scary sometimes.
Sometimes. I think it does to a certain extent. I think about what I eat beforehand. I think about caffeine as a stimulant before I race, getting the double espresso in before a 1500 meter race. I think about hydration to a point, but for such short distances, it's probably not that crucial. It might even be a bit advantageous to be a bit lighter, but there still needs to be some work done on that. I think if I moved up distance, I think I would definitely really start to think about what I was eating a bit more and how I was fueling and trying different things.
So it's a little bit of a broad question, but how important is hydration in performance? And I guess how does hydration affect performance?
It's very important. We see hydration from several aspects in terms of optimization. There's obviously the being hydrated before you go into a competition. And there's also what you do for your hydration status during a competition. Before exercise, it's important to be what we would term optimally hydrated. So in a state of euhydration by drinking sufficient fluid so that you're not starting in a negative state. And we've seen from several research within our lab and anecdotal work with teams that a lot of athletes do start dehydrated. So they're already a disadvantage before they go. And then during exercise, particularly in prolonged endurance events, we always talk about a level of dehydration that you can lose a certain amount of fluid before you start seeing negative effects on performance. This is in the literature are classed at about 2% body mass loss. So if you're a 70 kilo person and you lose 2%, that's the sweat loss of about 1.4, 1.5 litres without replacing any. So as soon as you go below that 2% threshold, it sort of suggests that that's when you get a performance decrement. I mean, what it tends to do is you lose fluid, so therefore you're increasing cardiovascular strain because you're losing fluid from the blood. So the heart has to work harder to be able to pump the blood around. And of course, stroke volumes reduced and cardiac outputs reduced. And is a negative feeling effect there as well. You don't feel so good. And so we try and prevent this 2% body mass loss. But there is some suggestion that it depends on the sport as well. So for runners, it's obviously advantageous to be lighter. So it may be that you are 3% dehydrated and therefore a little bit lighter, but you've got the more negative aspect of being dehydrated, but it kind of offsets with the being lighter and carrying less body mass around the course. So we're yet to find the optimal sort of level and whether 2% applies across all modes. Definitely in cycling, we see it. We've done some really cool work where we blinded people to whether they're dehydrated or not. So we've done a study. Typically, when you do a dehydration study and you dehydrate a subject, they know that they're being dehydrated. You can't really hide it. So there's that perceptual effect. So we call it a nocebo effect, where you perceive there to be a negative effect of being dehydrated. It's not particularly pleasant to be dehydrated, to go through that process. So that might have an effect on how you perform. But we did some interesting work where we blinded them. So we put a nasogastric tube down their throat and told them, well, we didn't tell them how much fluid was going in. So we were able to manipulate how much fluid was going into them. And so they didn't know they were dehydrated. And we still saw the negative effects on performance. So yeah, there's a threshold of about 2%. And once we go past that, then we start to see performance decrement.
I suppose kind of on the similar vein of that study that you just mentioned, do people start to notice when they are becoming dehydrated? Because obviously we don't know when we're 2% dehydrated, for example, but other than kind of feeling thirsty, are there other effects that we notice?
Thirst is the big one, but thirst is a notoriously sort of poor indicator. It's a difficult one to kind of utilize effectively, because if you feel thirsty and you have a drink, you say, I ate that thirst, the thirst goes pretty quickly, yet you still are dehydrated. You can satiate it with a couple of milliliters of fluid. You'll probably start to feel slightly warmer, which you do during exercise anyway, but thirst is kind of the first sign, and that's normally about 1%. We start to see that kick in.
And I think there's been quite a big drive, especially around marathons and drinking to thirst, because of risks of, as you mentioned earlier, exercise-induced hyponatremia. So would you mind just explaining firstly what that is?
So exercise-associated hyponatremia is when you drink, it's caused when you drink too much fluid. So you dilute the sodium concentration in the blood. And that draws water into the cells and causes them to expand and can cause brain edemas and can be fatal in extreme circumstances. So if we drink a very hypertonic solution like water or even sports drinks to a certain extent, and we drink lots of it, we're taking in this very low sodium or no sodium in case of water fluid, which then goes into the blood, is absorbed into the blood, and the sodium concentration that would be in the blood is now infused with a lot more fluid and therefore dilute, and therefore we end up with a sodium concentration that is a lot lower than what we physiologically would like. So typically, sodium concentration in the blood is around 135 to 145 millimoles per liter. When we dehydrate, this goes up, and when we overconsume fluid, it goes down. And anything sort of below, when it starts dropping below 135, 125, it can get quite dangerous. And there's these cases of individuals that are down at just over 100 or just around the 100 mark when real serious consequences. So it can be really, really dangerous. And it usually occurs when participants drink way, way too much fluid. And this can be a problem in the marathon. If they're out for a long time and they think they've lost lots of fluid and they see a drink station every mile, they think, well, I've got to rehydrate. And so they take on lots of water, some sports drink as well. And in the end, they end up suffering.
Are there any other risks associated with drinking too much water, or is that the main problem that can occur? And obviously that is quite rare in the context of marathons, but it's probably the most serious one that we're aware of.
Yeah, so it's quite rare. It's not as prevalent as it could be, but because it can be so serious and it can be quite difficult to diagnose, particularly with if you're at a point of care testing in a marathon medical field tent, the signs can be very similar to dehydration. So the treatments are very, very different in terms of the type of saline you might infuse to correct the problem. But negative health-wise, that's what happens with overhydration. But then you also have a much more common situation is you just don't feel good. You feel bloated. You're probably slightly heavier from drinking too much fluid, and so it's just a negative perception again, and it's just not pleasant to perform optimally. And then obviously in extreme circumstances, you have the risk of exercise-associated hyponatremia.
And we discussed that if you're not drinking enough fluids and you're becoming dehydrated, that's going to have a big impact on your performance, especially as that increases. In terms of health, are there any impacts to running and being slightly dehydrated, or is it mainly the performance effects that we see?
We predominantly look at acute effects on performance. So we'll put participants in a situation where they're at 2% or 3% body mass loss and see how their performance is affected. Long term, we're not sure. The body's pretty good at rehydrating after exercise. We've done some work on kidney health recently, looking at some of the biomarkers that are produced in the urine when the body is put under stress through dehydration compared to a euhydrated trial. And we've seen acute rises in these biomarkers that suggest there's renal injury following exercise when you don't drink during exercise. We've seen slight rises at 24 hours, but we've only really done it or slight maintenance at 24 hours in one trial, and it returned to normal in another trial that we did. So we're yet to kind of look at, well, what happens if an athlete regularly experiencing dehydration day in, day out, who's training very, very hard for 2-3 hours a day, how does that impact kidney health? The suggestion that there's not many athletes with renal failure, long-term renal failure, suggests the body is pretty well versed at returning it to a state of normality. But it would be interesting to have a look on how the kidney's functioning day after day after day.
So there's kidney injury kind of acutely after, say, a marathon, but within 24 hours, typically that's starting to resolve, and there's no clear evidence that that's going to have a long-term effect.
Yeah, so we've done some intermittent work, and there's been some studies looking at marathon runners as well. A lot of that is to do with muscle damage as well, and the increase in myoglobin, which also affects how the kidney or markers of kidney injury. So yeah, there's a whole host of factors influencing from a marathon perspective on how the kidney functions at the end of the race and potentially the day after.
So just kind of thinking about how people can manage their fluid intake during races. We kind of briefly mentioned sports drinks earlier, and I think you've done a little bit of work into sports drinks. So how do they play a role in managing hydration during events?
So sports drinks provide a delivery of, typically they comprise of carbohydrate, some sodium chloride, so salt, and water. So they're the three main ingredients. When you're doing a marathon, you obviously use fuel, which is glycogen, and this provides carbohydrate drinks, and gels provide a source of carbohydrate. So we call it an exogenous source of carbohydrate. So you take it in during a run, and that can help maintain blood glucose during exercise, which can help delivery of blood glucose and to the muscle where it can be used to produce energy. They help because they provide fluid at the same time. So you're kind of getting best of both worlds. You're not getting all of your carbohydrates from a sports drink. Typically, most sports drinks contain about 6 grams per 100 ml. So if you were to drink a 500 ml bottle, you're probably getting 30 grams in. But the likelihood of drinking a 500 ml bottle in a race in a short period of time is quite difficult. So for a marathon, we typically recommend about 30 to 60, maybe pushing 90 if you can get that much in. So you're looking at 500, 250 ml plus a gel, or slightly more fluid, or 2 gels to be able to get the recommended amount in. But because they have sodium chloride in as well, they will help on the hydration side in terms of fluid retention. So the sodium chloride will help retain more fluid, which will help maintain hydration to a better degree.
Have you done any studies that look at perception of hydration in athletes taking water versus sports drinks? I'm just wondering if people feel like they're better hydrated if they've had that hit of a sports drink that also has the other elements that are probably making them feel a bit better as well.
I'm trying to think whether we've done anything. I don't think we've done anything directly, possibly in terms of your perception of what you're getting. So if you think you're getting a sports drink, you might think you're getting a bit more, you're getting a carbohydrate, you might think you're getting a bit more benefits from that. Sometimes because of the flavorings in sports drinks, the palatability is a bit better. So your desire to drink is slightly higher. So we'll see that more fluid might be consumed on a carbohydrate drink than a water drink, just because the palatability is a lot more desirable. Anecdotally, yes, they probably would prefer it. But you've also got salt in there as well, so increased salt appetite during exercise. So even though it's very, very low compared to what you perhaps need, it will be, probably slightly more desirable.
And the other drink that often athletes are having, I particularly have it after a race, is caffeine. So I always want a coffee after I've ran. Probably not the best recovery drink, but it's my go-to. How does caffeine affect our hydration? I suppose before, in that lots of people take a caffeine either supplement or coffee before a race, and then afterwards in terms of rehydrating ourselves. What is the role of caffeine?
So caffeine was always thought to be a diuretic, and it is to a certain extent. It is a little bit, but there's been some work recently, a review, I think, by Sophie Killer and After Eufendruck, where they looked at caffeine as a diuretic and didn't see too much difference. It might have been in that review, or it might have been the work by After Eufendruck's group in Birmingham with a couple of other researchers looked at and didn't see it as a diuretic. In terms of hydration, it's obviously fluid, so it's good going in. You obviously beforehand get the benefits of the caffeine if you take it in the right dose and the right timing beforehand. And then afterwards, there's a rehydration. I suppose it depends on the composition of it. If it's an Americano and it's water, you're getting water in. If it's a latte and you're getting quite a high milk content in your coffee, then it's a perfect recovery agent. You've got you've got the milk, which is perfectly designed as nature's sports drinks for recovery. So the protein and the carbohydrates in the milk will be perfect for afterwards.
Unfortunately, I'm Americano, so maybe I need to just switch it up to latte. But no, that's a good point. So it's not quite as dehydrating as maybe we're led to believe.
No.
And the other thing that some people go for after a race is alcohol, so some beers to celebrate afterwards. Again, what role is that playing in terms of helping us hydrate and recover after a run? Or is that a definite no-no?
I don't think it's a no-no. I think it depends on what you're doing after a race, and in moderation, absolutely fine. I mean, if you're doing it in training and having lots of drinks after training constantly, then obviously it's not going to be very beneficial, but a small glass of wine or a beer every now and again is not going to do too much trouble. It's probably not the best rehydration drink, but then if you've just done your marathon, what do you need to be rehydrated for afterwards? You've done your race. You can spend the next 6 weeks recovering while you think about whether you're going to enter the next one or not. So I think it's absolutely fine afterwards. It's that social side aspect of it as well, and the psychological side of being relaxed and having a drink and enjoying yourself afterwards.
Perfect. And the final thing I just wanted to ask about in terms of things that we take that might affect our hydration, or I guess in this case kidney health, were NSAIDs, so non-steroidal anti-inflammatories like ibuprofen. There's often warnings when you do races that we shouldn't be taking those as painkillers because of the impact it can have on our kidneys, especially if we are becoming dehydrated. So do you have any comments about that?
NSAIDs is an interesting one because runners take it for a variety of reasons. Some take it proactively to kind of numb any potential pain they're going to get. Some use it to mask injuries. Some use it as a response to niggles that they've got. The ingestion rate can vary quite a bit. We've done some questionnaire-based work looking at what people take, and it can range from a normal dose to quite heavy dosages. But yeah, NSAIDs are seen as a risk factor for exercise-associated hyponatremia. They're linked quite heavily with it. There was a big study on the Boston Marathon in the early 2000s where it was seen it was linked as a big risk factor to those who had low serum sodium concentrations. And we did something at London a couple of years ago where we had two groups, those that took NSAIDs, those that didn't, and we saw lower serum sodium in the NSAID group. It has a downstream effect, so it affects prostaglandin production, which can affect kidney injury. So we see it from that aspect that it can be even on an acute dose. So an over-the-counter, I think we took 400 milligrams just before a run with steady fluid intake. So we took on equal to sweat rates, and we saw a decrease in prostaglandin even after that single dose, which has then an effect on how the kidney functions. And if the kidney's not functioning well, and there's a combination of increased fluid intake alongside that, then yes, there is an increased risk of exercise-associated hyponatremia.
So really, we should try to avoid that and maybe stick with things like paracetamol that we know are going to have less impact.
I think so. I think as the medic, you know
Yeah.
how the paracetamol and the NSAIDs impact together. I think it's not being over reliant on them and knowing that it can potentially cause problems, particularly if you're taking large amounts of NSAIDs.
Yeah, I suppose it goes down to why you're taking them anyway, because you probably shouldn't be racing if you're relying on taking any painkillers at all. You're probably not in the best shape to be running a particularly a long distance race. So maybe that's the answer.
Yeah, no. If you are relying on them, then you probably should take a break. It's hard, isn't it? If you've got that place in London Marathon and you've taken 15 years in the ballot and you've trained for 6 months, it's a very difficult decision to say, oh, bit of a niggle, but if I have this, then yeah, difficult.
And just in terms of marathon and training for all these months and then getting to race day, how important do you think it is to have a hydration plan and actually know exactly what you're going to drink and when and how much? Because I don't think many people truly do that. It's definitely the nutrition that we think about more than the hydration element, I would imagine.
I think it's important, but it's very, very difficult. We take two strategies. We kind of take a drink to thirst, where you drink whenever you feel thirsty, which has its problems in a race where drinks are at certain points. So what happens if you feel thirsty in between? Sometimes thirst works, and you drink enough to prevent a 2% body mass loss. Sometimes thirst doesn't work and you don't drink enough. Sometimes thirst doesn't work and you drink too much because you're not having problems with it. And the other one is to have a pre-planned approach where you drink enough fluid to prevent a 2% body mass loss, but not so much fluid that you gain weight. So that's in the American College of Sports Medicine recommendations for fluid intake. But that is all dependent on your sweat rate, knowing your sweat rate and understanding your sweat rate. And if you take London, for example, most people will train from Christmas time up to April. So they're training all through single-digit temperatures. And they come to London and they've practiced and they've done their long run and they've simulated their hydration strategy, worked out that they sweat, say, a litre an hour. So they need to replace so much fluid. And then they get to London and, like it was 3 years ago, it's 23 degrees. And all of a sudden, they're sweating twice as much and their hydration plan is all over the place. And so it's about being quite flexible. Conversely, if they'd done Boston Marathon, they trained for Boston Marathon, it was freezing. It was 0 degrees. And they needed raincoats and 3 layers and gloves and hats that year. So a week apart, Monday was Boston Marathon and it was freezing. And the following Sunday was London and it was 23 degrees. Yet you would have trained in the same conditions throughout the year to go and do these two different races. And yet neither one would have been supported by your hydration plan. So I think it's about being flexible. I'm not seeing a drink station and going, I have to have a drink. knowing when you feel bloated and know when to stop, and knowing that to get a balance of carbohydrates and fluids on board as well. Very difficult.
Yeah, and I think when you're doing a race, there's so many elements to think about that, putting all your effort into one aspect of it can be quite challenging when you're trying to practice all these other parts of it as well.
Yeah, very difficult.
Perfect. That was really interesting. Thank you so much. Are there any final comments you wanted to make or points that we haven't discussed that you think would be important?
No, I think that's about everything.
And if people want to find any of your work or find out a bit more about you, is there anywhere that I can direct them to?
Yeah, so you can search on the Loughborough University website, and if you search for my name, Stephen Mears, you'll find my profile on there. And then sometimes I use Twitter. I mainly use it for getting resources, but I do have a Twitter handle, which is @Steve_Mears. Sometimes I put stuff up. I'll put some of our work up when we release it, and so it goes on there.
Great. Thank you so much.
No problem. Thank you for having me.
Thank you to Steve for joining me, and as he mentioned, you can find him on Twitter by searching Steve_Mears. I'll be back for a few more nutrition episodes, and you can keep up to date by finding me on Instagram @marathonmedic or by visiting marathonmedic.com. Thanks for listening.